everyone. Today I'm here with Dr. Melanie Goldfarb.
Hi, Lauren. Thanks for having me.
Dr. Melanie Goldfarb is the Associate Professor for Surgery and Director at the Center for Endocrine Tumors and Disorders, part of John Wayne Cancer Institute at Providence St. John's. Today we'll cover thyroid cancer treatment options. Dr. Goldfarb, is surgical treatment for thyroid cancer a long and invasive process? What is it like for patients who are curious about procedure time?
That's a great question, Lauren, and something I always go over with patients when I see them in clinic. So surgery is the only treatment for thyroid cancer, so it's something that everybody has to have. And the length of time of surgery and what recovery looks like is a little bit different depending on what we're doing. So surgery could take as little as an hour and 15 minutes or as long as 3 to 5, 6 hours, depending on how extensive a cancer they have and how much surgery we need to do. When I do it, most of the time, most patients go home that day. So for most of my patients, it's an outpatient surgery unless they have a really extensive cancer. And most patients get a really tiny incision and they heal up really nicely with plastic surgery closures and no stitches to take out and no restrictions after surgery. But everybody's a little bit different.
Interesting. So how is the incision like smaller than a dime? What will we compare it to on a general basis?
So depending again on how much surgery we do, it can be as small as about 3.5 centimeters for many surgeries to having a much larger incision that we try to hide in your skin creases if we have to take out a lot of cancer.
Okay, great. And I think because of where the incision is, like you showed us, patients are often concerned about their voice having side effects. Are there any side effects we should know?
So that's a great question. Thyroid surgery is really safe. The one risk we do talk to patients about does have to do with their voice. You have these two nerves called the recurrent laryngeal nerves that sit in your neck behind your thyroid. And if you are having a surgeon that is a specialist that does a ton of these through your surgery, it is really rare to have a permanent injury in your nerve. But because we're operating in a really tiny area and ideally sort of squeezing things out through a little incision and just doing a lot of surgery there, it creates a lot of inflammation, and it's not uncommon to be hoarse temporarily after surgery.
So after surgery, you might be hoarse or have some soreness, but it sounds like it doesn't usually affect the nerves. So do you monitor those nerves during surgery?
Oh, another really good question. So so most of us use a specialized nerve monitor that lets us check if your nerve is working when we're done with surgery. So even if you wake up a little hoarse, I can be very confident that your voice is going to come back and your nerve is working fine.
Wow, that's so high tech. How interesting. How cool. So after surgery and after recovery, do you commonly see thyroid cancer recur? Is there post-treatment monitoring that happens?
So that's really important. What I tell most of my thyroid cancer patients is two things. You should think of yourself like you don't have cancer, so you live your life and do whatever you want, but you have to remember that you're a cancer patient because thyroid cancer can't come back. Even though it's not one of those cancers that we talk about survival and death, we more talk about things in terms of risk of recurrence. So we do monitor patients. Usually it's your endocrinologist plus minus your surgeon who's keeping an eye on you, and we do this mostly through blood tests and sometimes through ultrasound or other imaging.
So what are the risks that maybe cause recurrence to be more common? Are there any factors that we should think about or know about?
So the risks for recurrence mostly have to do with your pathology. So how much cancer you have and how ugly it looks like under the microscope. And that puts you on a spectrum of what your likelihood of recurrence is.
I think a lot of people are kind of familiar with aggressive strains of breast cancer. So some of those more aggressive breast cancers we've had, and we'll use an analogy, thyroid cancer like that, then it might be more likely if you had a big and aggressive thyroid cancer that you would see a recurrence, but small, tiny surgery, small cancer, maybe less likely to have a recurrence?
Yeah, I generally don't like to compare thyroid and breast because they're two different beasts. But yes, again, along those lines, if you have an aggressive histology that is big and ugly looking and growing into your tissues, yes, that's going to have a high chance of recurrence. But the little tiny thyroid cancers that we get out and not really touching anything, it's a very low risk of recurrence.
That's super helpful. Thank you so much for your time today, for your expertise. As always, a pleasure to have you.
My pleasure. Thanks, Lauren.